We are back now with our sponsor, Dr. Rhys Branman of the Cosmetic Surgery Center. We're going to talk about how to plan for so many of the things he talks about that we could do: injections, chemical peels, cosmetic surgery. You know, how much time do we need to plan and what do we need to do? Good to see you.
Good to see you again. Yeah. Happy holidays.
Happy holidays to you. And I think this is a great idea to talk about, you know, what you need to think about beforehand.
Well, you know, we talk about all the things that we do, but we never really talk about what you need to do ahead of time.
Yeah.
And so I thought this was a great time to do that.
I do as well. So we're going to go over like specific times, like how many days or weeks you need to think about. But let's just talk about in general, because a lot of us take aspirin and we take other prescriptions. Do we need to plan to quit those at times?
Absolutely. Let's talk about like the easy things.
Okay.
We talk about Botox and fillers.
Okay.
Those two things are very easy. People come in and say, hey, I want to get this done, but they don't realize that, number one, the Botox takes about a week to take effect. So you should do that at least a week ahead of time.
Okay.
And even though the fillers, they take effect immediately, a lot of times you need to have a little bit of time, maybe 2 to 5 days, in order to get the swelling out, so everything looks good. And all these things, whenever you're injecting something, you can always get a little bruise, and that can take up to a week to get gone, to disappear.
So if you're planning this for maybe a high school reunion to try to look a little younger,
holiday parties,
or pictures you're going to have made,
that's right.
Probably a week out on those things.
A week out on those things. And so if you're planning on doing something for the holidays, Christmas, New Year's, now is the time you want to get that done.
Okay, very good. Now, the more we go up in, you know, how much time it takes to get over, the longer you need to take off work.
Yeah, so let's talk about like chemical peels, for example. There are a whole variety of chemical peels, but if you're getting a deeper chemical peel, you're going to need at least 2 weeks to completely heal up, and then another 2 weeks for the redness to fade out.
Okay, so that's a month.
That's 4 weeks.
Yeah.
So if you want to look smooth and glistening and ready to go for like a wedding or holiday party, got to give yourself about 4 weeks. Okay,
you're talking about those deeper chemical peels where it's like a really bad sunburn for a little while.
Just like the light chemical peels, 3 to 5 days.
Okay.
You're good.
Good to go. Okay, let's go on up to some other things, like we're trying to get ready for swimsuit season, say.
Swimsuit season, yeah. So that's the big January push where people are really wanting to get ready. And that's good because if you give yourself 6 to 12 weeks to heal up, you can be in a bikini or wearing that, you know, if let's say for weddings, you want to get into a wedding dress, you can get sized in about 6 to 12 weeks. The implants tend to sit high for a little while and then they drop down slowly over time. And so it does take that long to really get that look that you want.
That's why you have so many people coming in now for summer season, right?
Yeah, now's the time that we have people coming in. They're getting their breast augmentations, liposuction, and even tummy tucks. And with tummy tucks, you have an incision that needs to heal, and that can take about 12 to 16 weeks for that to really start fading out.
Okay, so if you're trying to get that flat belly for a bikini, then you need to make a little bit of time for that, and don't wait until everybody's headed to the lake and pool, right?
Yeah, don't wait till, you know, July.
Right.
Because you won't be ready till September.
Okay, and then a lot of people are getting engaged right now and setting their wedding dates, and you were just mentioning wedding dresses as well. You need some time for whatever you're planning on doing.
Absolutely.
Okay, let's talk about just things like taking aspirin. Some people still smoke. What do we need to do?
So a lot of people will have certain habits or, you know, good habits. They take like vitamins and natural things like herbal supplements. Those are the things you need to stop ahead of time. Protein shakes, stop all that stuff. A lot of that stuff has things you don't know what's in there, and it can cause bleeding. And if you're having a surgical procedure, bleeding and surgical procedures don't go well together.
Okay, so you don't
I would stop those at least 2 weeks ahead of time.
2 weeks out ahead of time.
Aspirin, ibuprofen, all your herbal supplements, as well as things like protein shakes that you don't know exactly what's in there.
Okay, we've mentioned smoking before. It's not good for anything, but especially you know, when you're trying to recover from something, right?
And I think that, you know, smoking is one of those no-nos that we don't want you smoking at least 6 weeks before your surgery and 6 weeks after your surgery.
Okay.
So, and it's really critical because you can have a bad result just from smoking alone.
Your body just can't recover.
Can't recover. The blood supply doesn't work well with someone who smokes, and you can have, you know, just devastating results if you're smoking around surgery.
Let's talk a little bit about tanning. If we're talking about, you know, facial treatments, we use a lot of self-tanners and all of that right now. What about those?
So with tanning, you know, we don't want people tanning, period. If you're doing chemical peels or kind of resurfacing type of things for your face or your skin, the tanning will do almost like the same thing that smoking does. It's going to hurt your skin. You're going to get worse results. You may even get certain types of results like what we call hyperpigmentation, or the skin gets brown and you can't get rid of it. And so you really don't want to be tanning anytime around any kind of resurfacing procedure or surgery.
And if you're getting that beautiful new skin, you don't want to tan.
Why do you want to do it?
Exactly.
Exactly. Why
you're
do you
going
want to
back on what you've just been taking care of. Okay, I love this that you know, kind of tell us how to prepare for so many of the things that you offer there at the Cosmetic Surgery Center. Is it getting busy?
Oh, yes.
Oh, yes. But gift certificates are available?
Gift certificates are available. We have specials on various items. Just call the office and they'll inform you about that.
If someone has always said, I really wish I could do this, then you can set it up for them and then they can come in.
And make sure you give yourself enough time
to
heal up.
That's great. That's what we learned today. There's the information on your screen of the Cosmetic Surgery Center. Go see them online, too. That's a great place to go look at befores and afters and kind of get set up that way. Thank you, Dr.
Thank you very
Rhys.
much.
Happy holidays.
Happy holidays
Good
to you,
to see you. Okay, back in just a moment. Up next.